Thank you all for joining us today. We are with NYU Langone Center for Cognitive Neurology and the Pearl Barlow Center for Memory Evaluation and Treatment, and our CEAD, also known as Center for Excellence for Alzheimer's Disease. And today we have Haverty Brown, LMSW, with us, and she will give us a presentation on getting started with advanced care planning. We will have opportunity for questions at the end. So if you have any questions, you can put them in the Q&A box at any point, and we'll give you the opportunity to ask them at the end, or even raise your hand and turn your mic on to have a discussion with us. All right, and with that, I will turn it over to Haverty.
Great. Thank you, Abena. I'm very glad to be here with everyone today. So just brief introduction, even though Abena already gave it, but I'm the social worker at NYU Langone's Center for Cognitive Neurology, which is also the home of the Pearl Barlow Center for Memory Evaluation and Treatment. And we're also a New York State CEAD, which is the Center of Excellence for Alzheimer's Disease. So we provide information, resources, both to patients and the public through the CEAD. So very glad to be here with everyone today. And I know we likely have lots of different people and perspectives joining us. Perhaps you are a patient at NYU, perhaps you are a loved one or a family member of a patient or a professional in the field. So hopefully we can all come together around this topic of advanced care planning and know that there's something for everyone in this conversation at any stage, no matter where you are. So hopefully this will provide some introduction and getting started with wherever you are in the advanced care planning process, and you'll get some resources out of today. So to begin, a few goals of today's presentation. So first of all, of course, it's just understanding the process of advanced care planning. And this is a word that I will come back to a lot, as one of the big things about advanced care planning is knowing that it is a process. It's not something that you can do necessarily in 1 hour or one day, but it takes time and takes revisiting. But it's important to get started, so that's why we are getting started today and evaluating where you are in the process of advanced care planning, as well as, importantly, what are the key documents to complete. So as a part of that process, I hope today will help you identify the important questions to ask yourself, as well as your loved ones, to support with the advanced care planning process. Because a big part of advanced care planning, as we'll get into, is reflecting, thinking about what's important to you, your values, and then asking yourself a lot of questions. And then I hope also that this will be practical as well. So considering what are your next steps in advanced care planning and just emphasizing that the time is now. It's never necessarily a convenient time to do these advanced care planning steps and reflections. So really taking advantage of of showing up today, of taking this time out of your day to be here and use this as some momentum to take your next steps in advanced care planning. Because we know there can be lots of barriers and it can be challenging to kind of take the time out of our lives to do this. So I hope that this time together, this presentation, and some of the reflections we will do will help you move forward in that process and give you some concrete next steps to take at the end of this hour. So with that, I invite everyone to grab there we go. Grab a piece of paper or a notebook, or just open up something on your phone or your computer where you can do some writing. I hope you're able to engage in this, and we will have some time as part of this presentation to do some reflection and some writing. So really encourage you to take part in it however you're able to today. So I know we've been using this word advanced care planning a lot, and maybe you've heard it from your healthcare providers. You've heard it just by signing up for this presentation, but let's talk about what it is. And there is the word again, a process that includes the following things. So a big part of advanced care planning is reflecting on your wishes for future care. And this has a lot to do, as we'll get into, with your values, your preferences, your relationships, and your health status. So care in this case might mean medical care. So care you would receive in the healthcare system, whether at a hospital or in your home. And also, how do you wish to be cared for, or how do you imagine talking about that? So we'll get into that, how to talk about your care preferences. Um, so another big part of this is not just reflecting internally on your wishes for future care, but also on who are the people in your life, the trusted and supportive people that you would want involved in your health care. And this is important too, because sometimes people make assumptions about who you might want involved in your healthcare. And that's part of the reason that we really emphasize completing the advanced care planning documents to make it clear so that we don't make assumptions, whether it's in the healthcare system as a healthcare provider, your doctors, or family members or others in your life, so that you can really feel clear on who it is that you trust, that you feel supported by, and you want involved in your care. People might assume it's your spouse, or they might assume it's your parent or your adult child. But for you, that might not feel most supportive, and they also might not be as willing. So that's a big part of this process too, is clarifying that. And so alongside with that, these reflections is having meaningful conversations about your health and healthcare preferences. And I hear from a lot of people in my work that there is some hesitation to do this, and that's very normal, to feel sort of the weight of these conversations and not quite know how to go about them. And I find that, oftentimes people really want to have these conversations, and it is just the getting started that's hard. So that's why I hope this presentation will help you reflect on, who do I need to talk with? What would be helpful to talk about? And who can I share this information with? And we'll get into then the documenting of your wishes using standard documents. And the reason I say standard documents is because we'll go over the ones that are, but just so that it's clearly communicated both to your healthcare providers and the healthcare system, as well as to your family and friends. So we try to create clarity, even in the midst of, a very uncertain future, which is a big part of advanced care planning. That the future is uncertain, but what can we do to help clarify what we can? And then also one last point to emphasize is that advanced care planning, ACP, as it's often abbreviated, is for everyone at any age, any stage of life, not to put it off. I mean, we all know, of course, our health status can change at any time. So anyone can participate in advanced care planning. It just might look, of course, very different at different stages of your life. And that's part of the process of advanced care planning, is that you will probably change your preferences or who you would want involved in your care. So it's never too early to start. And that's part of this conversation today. Kind of the meat of our presentation today is we will get into this guide that NYU Langone's Advanced Care Planning Department, their program, put together. And I will put a link in the chat to it. It's available on the NYU Langone website as well, which I will also share. So I will open this up and I also invite you to open it up so you can go through it, or you can just follow along with me if you would rather just stay on this one screen. Um, and I will also put in the chat another link here to the website where this guide is located, as it has this translated into several languages. So that could be very helpful if you have family members or loved ones, or if you have clients who might need this guide translated in other languages. So check it out on that website. So let me switch my screen here to get into this guide. Okay, good. We can see it. All right. So there's a few things on the first page that are a repeat of what I just went over in terms of it's never too early to plan for the future, and where to begin. And this guide lays out these 4 steps, which are pretty similar to what I just talked about. But one thing I want to emphasize as we're looking through this guide and looking at these steps is that this order that they lay out might not make sense for you. And it might be okay to do these steps out of order. In fact, it is. So as you are considering your wishes for future care, maybe you're realizing that actually the first thing I want to do is talk with my family or talk with my friend or whoever is going to help me think through this, or your provider, your healthcare provider. So you don't have to do this alone. So this maybe sort of feels like if you go through these steps, you're kind of thinking about it all on your own and then sharing, but it's absolutely okay if it makes sense for you to do this in a different order. And for some people, that is much more helpful. And for others, this is more of a personal reflection that you do on your own and then open it up to sharing with others. So as just wanted to make a note of that, we see these step 1, 2, 3, 4. So use it in the way that works for you. But we will go through the guide in this order, just as it's laid out like this. So considering your wishes for future care, selecting a healthcare agent, documenting your wishes for future care, and sharing your wishes for future care. So we will take some time now to work our way through these steps, and knowing hopefully that this is the catalyst, is a push for you to take some action on these steps. So as we get into considering your wishes for future care, know that this brings up a lot, right? This is challenging because of the uncertainty. You might be feeling a sense of your own impending changes in your life based on your health status. It might bring up feelings of grief or loss, knowing that your life will be changing, as all of ours do at certain times, and that you may need different types of care or more care. So this process is not easy at all, and that's why we really encourage people to take the time, seek support from professionals, and also from your family or your loved ones as you go through this process. So this is a moment to just invite you just to kind of settle in to wherever you're sitting. Hopefully you're sitting, and or if you're walking or working or doing something else, just take this time, at least these next few minutes, to just kind of allow this reflection to bring up whatever it brings up in you. And we're gonna go through this and do some reflection together. So just knowing that for some people, this is easy, and for some people, it's very hard. In fact, for most people, it's challenging. So that's why we're going through this in this presentation, and we'll also share other resources for how to get support. So when you're thinking about your future care, um, some of the questions to consider are, what is an acceptable quality of life for you? And that means, of course, very different things to different people, and that's part of why you go through this process. Another thing is the importance of understanding your health status, meaning where are you at in that process? For some people, you might be very much in the middle. I don't really understand what my diet, if I have a diagnosis, what's going on for me. Others, you might have more clarity. And it's just important that part of advanced care planning is just meeting yourself where you are and knowing that you do this planning and you do this communication and documentation and sort of just to the best of your ability with as much information as you have right now. And with that, it's also important to think into some scenarios into the future that we all might have complications or we all don't know exactly what our needs will be. So we are trying to anticipate our needs, but knowing that we will do it probably imperfectly, right? This is like a draft. It's a constant draft of what do we think we might want or need, and we're trying to communicate that as best we can to our healthcare providers and to our loved ones. So next, we're going to go through this list of questions here. And this is where I really just invite you to just pause with whatever else you're doing. And even you could close your eyes or just take a moment to reflect on these questions. And then it'll give us a little bit of time afterwards just to write down anything that comes up for you as you're reflecting on these questions, anything that you personally are thinking about that comes to mind or any feelings. But additionally, if there are questions that you really don't know the answer to, because that is really important information. So I would encourage you just to note that if you get to one of these questions and you don't have a feeling or a thought or an answer, totally okay, but just really important information for you. And that might prompt a further conversation with a doctor or a family member or just yourself, further reflection down the line. Okay, so I'm going to read through this list of questions. And like I said, take some time just to reflect and let this kind of see what comes up for you. So let's just take a minute to take a breath together. So wherever you are, take a deep breath in and out. And like I said, maybe close your eyes, or if you have something to write on, you could write down just some words or feelings or associations that come up. So reflect on the questions and statements below as you consider your wishes. What gives my life purpose and meaning? What gives my life purpose and meaning? What aspects of my physical and mental health are most important to me? What aspects of my physical and mental health are most important to me? Do I have any religious, spiritual, cultural, or traditional beliefs that impact the type of healthcare I want to receive? Do I have any religious, spiritual, cultural, or traditional beliefs that impact the type of healthcare I want to receive? When I think about the future, I want to avoid what? When I think about the future, I want to avoid what? What does a quality of life that is not acceptable look like to me? What does a quality of life that is not acceptable look like to me? I would want to be kept alive as long as I am able to what? I would want to be kept alive as long as I am able to what? Under what conditions would I decide to change my treatment goals from prolonging my life to a focus on my comfort? Under what conditions would I decide to change my treatment goals from prolonging my life to a focus on my comfort? Okay, so those are some big questions. I know a lot comes up for me as I read them. So I invite you now. I'm just going to be quiet for a few minutes and um, just write down feelings, words. They don't have to be complete sentences, but just anything that came up for you to make a note of, or like I said, if you don't have an answer, make sure to note that as well. Say, I don't know, and I would like to find someone to talk to about this. So take a few minutes right now just to write down some notes. Right, and then we'll continue on in these questions. And once again, these are questions to help you think through this process. So certainly come back to them as you continue. So another really important consideration for advanced care planning, and I'm sure this is already coming to many of your minds, is your experience with other people, with maybe your family members who have had a serious illness or at end of life, and what was their experience like? So making sure to note that too, and just to be aware of that, be aware of, okay, I think I want this because of my father's experience or my spouse's experience. So just making sure to note that it can be just helpful to explain that to a healthcare provider or a loved one as you are communicating your wishes. So a few more questions. One of my favorite questions, which is if you were having a good day, what would happen on that day? I think it's always nice to have an image of a good day for us. And that, of course, shifts and changes over time, and that's part of this process. What does living well mean to you? Who would you talk to? What would you do? So taking some time to just let that come up for you as you're going through this process and communicating this to others. The next question down here asks about cultural, religious, spiritual, or personal beliefs that might help you choose the care you want or do not want. And this is also where I think it's also important to point out you can, of course, speak with your healthcare providers, but also religious leaders, anyone else that you feel can help you with these decisions. Spiritual leaders, very important to just consider that as you're going through this process, that there are multiple players in advanced care planning. So understanding who might help you think through some of these questions. And this is a scenario that they include here that, all of us would need to think about at some point. And this may or may not be sort of what's on your mind as you're thinking about advanced care planning, but it is an important one for people of all ages. So we all know that accidents can happen at any time, and perhaps a sudden accident occurs that leaves you not able to communicate. You are getting all the care you need to keep you alive, but the doctors believe there is little chance you will ever recover the ability to know who you are and who you are with. Would you want to continue medical treatment to keep you alive, or would you want to stop medical treatment to keep you alive? So, in either case, you would be kept comfortable, but what would be your instructions for your healthcare agent and your care team in this case? So this is a scenario that can help you think through, what matters to me in terms of when I'm at end of life, or if I'm in a situation where my functioning has changed a lot. What is important to me, and what do I want to communicate to my loved ones? So we will next get into the process of selecting a healthcare agent and making that clear to your healthcare providers as well. Okay, so a healthcare agent, also a healthcare proxy, is a term you might have heard before as well, is a really key part of advanced care planning. So what is a healthcare agent or a healthcare proxy? It is someone that you appoint, an adult, 18 years or older, to make healthcare decisions, just healthcare decisions for you, in the event you are unable to do so for yourself. And this could be for a variety of reasons, like the past scenario from an accident. It could be you are in a planned surgery and you're unable to communicate. Or it could be in the case of many patients here at the Barlow Center, where someone with dementia over time loses the ability to fully understand their healthcare decisions and might need support. So we call that supported decision making, where not someone is not making decisions for you, but you have a loved one or you have your healthcare agent, whoever you appoint, support you in fully understanding your healthcare decisions. So a healthcare proxy can only act if two physicians declare someone does not have the capacity to make their own healthcare decisions. So it's important to know that just when you appoint a healthcare proxy, you're not just giving them the power to make your healthcare decisions. It's only in the event you are unable to do so or could not fully understand the risks and benefits of healthcare treatments or decisions. So healthcare agent is a very important role. And this is certainly something that anyone at any life stage or health status can appoint. And a good healthcare agent is, of course, someone that you trust and who knows you well, or who you feel you can communicate your wishes to. Would be comfortable making decisions in a crisis or a stressful situation, will make decisions on your behalf. And they will be entitled to make decisions. They do have to follow your wishes. But in that moment, perhaps you might not agree with them. And they ideally can easily be reached by phone. So they don't have to live close by, but it can be helpful, but it's not necessary. And they should agree to take on this role. So, of course, questions to ask yourself is, do I know someone who could help me in my healthcare wishes, whether now, if you need this support already, or into the future? And then how do you want to ask them have this conversation? And we also usually recommend that people choose two agents. It's very helpful to have a primary and have an alternate in case your healthcare providers are not able to reach the primary healthcare proxy in some kind of emergency. So some important note, and this is particularly for New York State. So if you live in a different state, this might be different. But in New York State, the Family Healthcare Decisions Act outlines what they call a surrogate list, meaning people who would make healthcare decisions be your surrogate for you in the event you're not able to. And it goes in a certain hierarchical order. So if you have a spouse or domestic partner, that would be the first person, then an adult child, parent, sibling, close friend. So this is important to note, particularly if especially if you do not want one of these people to be the person making decisions for you. Or, for example, if you have more than one child, this doesn't specify which child would make the decision. It would be whoever they could reach first. So this is important to note so that you can really be clear with your healthcare providers and your loved ones. You know, who do you feel comfortable? Otherwise, your doctors, the EMTs, right? People would default to this order in New York State. So important to note that in other states it might be different. So that's one of the reasons to appoint a healthcare agent is to really clarify this, especially if for you this order would not be your preference. Okay, so this leads us now into the actual documentation of your wishes for future care. So how do you communicate this other than having conversations with your loved ones or your healthcare providers? So that's where these standard documents come into play. So there are a couple of types of advanced care planning documents, and this guide, it goes over these two advanced directives. Express your medical or healthcare wishes if you become unable to communicate them on your own. And then there are also medical orders, which are similar, but they are actually signed and created by your doctor, and are more for people that are closer to end of life or have a very life-limiting diagnosis. So some of the key forms, and we'll give you some links to these forms as well so you can save them and open them up for yourself. Key forms in New York State are the healthcare proxy form that enables you to appoint a healthcare agent. Sometimes we just still call it the healthcare proxy as well. And this is a standard form. It does not need to be notarized. It is not a legal form. It is a healthcare form, but you do need two witnesses who are not your healthcare agents to sign the form, just to certify that you are making this decision of your own free will and you have the capacity to make this decision. So these could be friends, neighbors, could be at your doctor's office. Your doctors can be a witness as well. So this is a great form if you have not completed the healthcare proxy form at your next doctor's appointment. Tell your doctor, I want to do this form. A lot of doctor's offices have them printed, and then they can scan this directly into your chart so that it will be saved there and your healthcare providers will have access to it if needed. So the healthcare proxy form gives a little bit of room for you to write your healthcare wishes, meaning questions to ask yourself, which we'll get into with the living will, about your more specific healthcare preferences. But it's just a little box on there. So a lot of people want to document their wishes in what's called a living will. So meaning while you are still alive, here are your healthcare wishes in a little bit more detail. So these would be questions around, would you want to receive CPR? in the event that you needed it? Would you want to receive artificial nutrition and hydration or intubation? And these are questions to discuss with your healthcare provider, with your doctor. You can also, of course, discuss it with your family members based on your personal experience or your cultural religious beliefs. So, but this is what the living will helps you document. And a living will also is not a legal form. Some people do prepare it with a lawyer, but it's not necessary to, so it does not need to be notarized. And we will provide you with an example of a living will, a very simple one that you can complete, but it does need to once again have two witnesses that you certify that you are making these decisions and they need to sign that. And a living will is also another form, great form to bring to your doctor's office and have them scan it or send it and upload it to your medical chart. So it's in your record and your wishes are documented there. So another form, this is the medical order form, it's called a MOLST, MOLST. And in New York State, this is the preferred form. Once again, in other states, it might be different. And this is actually a form that your healthcare provider would fill out themselves, and then it's part of your medical record. So it's similar to a living will where it is stating your preferences for what kind of care you would and would not want to receive. But it has more detail in it, and it then officially goes in your medical record. So this is something to discuss with your healthcare provider, and generally is seen for people who maybe live in a long-term care facility or have less than a year or so to live. But it's important to discuss this. It's very similar to a living will, but has more detail and would then live in your medical record. All right, so as you are doing this process, like I said before, you might be throughout this whole thing sharing your wishes for future care. So this is an ongoing part of it. Or you might wish to do this on your own, or this in the circumstance that makes most sense to you. And then at some point, having a conversation about your wishes. As well as then how to actually communicate this, how to make it clear. I have a friend whose parents made it their own PowerPoint presentation, and they review it every year with my friend and her siblings. So they put it all in a PowerPoint, and that's how they do it. They like to have it all be clear, put their wishes in a place where their adult children know where to find them, and they like to review it every year. So that's one method. Some people prefer, of course, to have it all in print, paper copies, and put it in a secure location. But there's lots of different ways. So you want to make it work for you. But part of this is knowing that you can make all these documents and do it, but if no one can find them or you don't give anyone a copy, then they're not as helpful. So part of this process too is thinking ahead to, who do I need to give a copy of these documents to? And usually the key people are to make sure that you have a copy, to give one to your actual healthcare agents, and provide it to your primary care physician, your healthcare providers, or for example, at NYU Langone, we would upload a copy of your healthcare proxy, and then any provider within our system would be able to access that in the event that it's needed. So part of this is the communication process. This is the part I think sometimes we avoid or is hard to get around to. And I find it really is a gift to communicate your wishes to others. So we're doing all of this to both help clarify for ourselves what is important, but also for our loved ones to help make these decisions easier in a stressful situation or a situation where there's a lot of uncertainty. We cannot control everything, of course, but we can make these decisions to both help support ourselves and help support our loved ones in this process. So, this guide has a few more questions and answers that are helpful, great at the end. Something I want to highlight here that I really like is down at the end is the expiration of advanced directives here. And they do not expire, but we do suggest that you update them periodically whenever one of these 5Ds happens. So that would be the death of a loved one, a divorce, or a separation, doing it every decade or milestone birthday, so every time you turn a certain age, a diagnosis of an injury or some injury or illness, or some kind of decline in your health status. So knowing that it's good to plan on birthdays or on certain times of year to go back to these documents or when a major life event happens. So this is the guide. It's available on the website. We put it in the chat and we'll also send it out afterward in an email. And we'll end in just a few moments to give time for questions, but just also wanted to list a few other forms and advanced care documents to complete here. So we reviewed the healthcare proxy, the living will, and then the medical orders for life-sustaining treatment. And we will send out just links to these forms so you have them. Another important form that we won't get into detail about today, as it's not a healthcare form, but that is important to complete, is a durable power of attorney. Also very important to appoint someone to make legal financial decisions for you while you are alive, in the event that you are not able to make these decisions for yourself. So whether it's you are in some sort of situation where your capacity is reduced and for a short temporary period of time, or you know that your cognitive capacity will change over time with the diagnosis of dementia or another disease, and you know that you will need support, or just you want to have someone else who's able to help support you in managing your legal and financial affairs while you are alive. So this is a legal form. So many people work with an attorney to complete this form. There's also New York State has what they call their short form power of attorney, and you need to get that notarized. So this is a separate form from the healthcare forms, but another really important one to complete. And then finally, the other advanced care planning form that can be really helpful for certain people, especially if you don't have close loved ones that live near you, or you don't have people who will be able to be very involved in your care, is called the disposition of remains. And this is a New York State form that clarifies who will be responsible for your remains after your death. And it's a standard form. Same thing needs to be witnessed and needs to be signed by an agent, by whoever you appoint, but can be very helpful to just state if you have made funeral arrangements, which funeral home to contact. And this can be something you keep at home. It can be something that's on your medical record in the event that you're hospitalized. So just to clarify, as well, especially if you don't have someone who is close to you who would be able to handle this, whether it's the funeral director or who you would need to, so who the healthcare providers would need to speak with in the event of your death. So this is another very important form to fill out. Makes more sense for certain people to do than others, but it's not as well known or talked about as these other forms. So just want to note that there. And we will be sending out an email with all the information and links to these forms so you can look over them. All right, so I'm mindful of the time and just want to give time for questions. And but before I do, just like I said, really encouraging you to use this time we spent together today as a catalyst. So, what are your next steps? Who do you need to talk with? What forms do you want to fill out? We know this can be difficult to actually kind of keep moving in the process. So also seeking out support from your primary care provider, your any other doctors that are involved in your care, a social worker, family members, attorneys. So thinking about who would be helpful in this process for you. So thank you all, and I'll pass it back to Abna to help with the questions.